Cyprus Facial Surgery at YouTube.
In expression lines and wrinkles. A facelift procedure addresses these areas and helps rejuvenate you by returning you to...
Hello guys, this is Dr. Neo here from Cyprus Facial Surgery. We're here today for a new series of videos. As I told you previously, I'm going to try to answer some questions, keep you company, educate you in regards to cosmetic surgery. I know all of you are home due to restrictions. Keep actually staying with us. We're going to have a live on coronavirus coming up because I heard plenty of you gave us a lot of questions and you have many actually questions in regards to this coronavirus. But today I'm going to make this atmosphere much more pleasant and I'm going to talk a little bit about cosmetic surgery. Now that we're home, it's a good time to actually understand what a facelift is, who is a candidate for a facelift, which doctor should we actually look for, and what should we expect about a treatment that we get in our face. Don't forget that if you go to the mirror always says the truth. And of course, the mirror is what you're going to see, and the mirror never lies to you. So today we will explain the potential actually patients for facelift, what are the capabilities and what we correct with the facelift, and of course, what you need to understand in this procedure, what are the types of facelifts and what the facelift can give you. Of course, as I will explain today, many of you asked me a couple of questions and I'm going to try to answer, and probably next week I'm going to have a combined live video with one of my friends in New York who does a lot of facelifts and discuss many of the aspects of facelifts. But today, at the beginning, I'm going to start in a little bit of a presentation to understand how we age, how this works, what the facelift is, and you can watch this monitor when I explain this. And of course, as you know, as we age, we start losing elastin and collagen from our face. And of course, the face, as we age, it becomes more skinny and less actually resilient. So what we lose the elasticity of the face, and of course we lose a lot of collagen of the face. Before we start to discuss about facelift, let's give a look and see how we age. At the beginning, what happens into a face, and I'm going to go here and start explaining that on the live patients. As we age, we start having some of the aging signs showing up. And this is the aging signs of a patient that, as you can see here, we start having a little bit of lack of elasticity, a little bit of lack of collagen. Due to the dynamic movements of the face, we start creating wrinkles and dynamic wrinkles, which later on they become more static wrinkles, more permanent wrinkles. As age progresses, and this aging disease affects other parts of the body and the skin as well, this area of the face will get even more affected. We're going to start losing volume of our face. And of course, on this area here of the mid face, if you can see here, this patient here, as I'm drawing, and this patient here, we're going to start losing volume from there. This is the area of the fat. I'm going to start opposed fat here. So we're going to start putting fat on the lower part of the face, where this actually gives us this fullness of the lower face and emptiness of the upper face. And of course, as that goes, the next step of this process comes, that ties that they tie the skin and the muscles of the face down to the bone, the ligaments, they get loose, and we have some gravitual force that pulls down everything. And what we have this eyebrow here that actually goes down, as you can see. We have this hollowness or some bulkiness on the area under the eyes. We have this deepness here. We have a deep labiomental folds. We have the fullness of the neck, and of course, what else we get? We get that migration and descent of the skin of the midface down to the area of the neck. So, if I go back and I put another picture on, if I go to the gallery over here, and I'll show you what I mean with these pictures in a second. So we have a patient on the profile, and what we see in this patient, we see a couple of things that I'm going to mark here for you to understand in a very, very distinct way. So as you can see here, we have all the things we described. We have some descent of the mid-face. The mid-face here, it descends inferiorly. This line here, the line that we name as the jawline, or I don't know if you can see, I'll make it a little bit more prominent. This jawline here is being obliterated. There is no significant demarcation of this line because this area here is being in continuity with the midface. So there is no significant separation between the midface here, this area here of the midface, all right, and this area of the neck. We have some excess fat and tissue on this area here. This area here, we name it the submental region, and you can see that there is obliteration of this angle, the chin-throat angle. It's obtuse angle now with a lot of excess fat. You can see, if I put a circle there, all this area here, let me just take it down to a smaller area and just show it to you. I can probably put a square here. Not a good idea either. But if I go with a pencil and I just draw that, you can see that this area here, as you can see, is white, that exists on this area. It's an area of excess fat and skin due to the loosening and migration of the skin. I'm going to show you even more stuff here. As you can see, what we see even more, we see this area here between the chin and the jawline, this area that collects fat, and we name this as jowling. Jowling is where the fat collects and accumulates on this area, and because of the migration and loosening of these ligaments, the mandibular ligament here we have a ligament, which is the mandibular ligament. Here we have another ligament, the zygomatic ligament, or the McGregory ligament. Those are ties that they tie down the skin into the bones. And of course, these ligaments, they get loose, and everything due to gravity moves down. All right? And this down migration gives us this aging sign of deep labiomental fold, this excess of the fat here, the jowling on this area, and of course, the lack of demarcation of the line of the jaw between the neck and the face. So, what we try to do, what a facelift candidate is, and many of you keep asking me, who is the best candidate? Who is a candidate age-wise who can get a facelift? There's no age. In this type of work we do, the biological age is what actually determines who is a candidate, who is not a candidate. And what do I mean by the biological age? Biological age is the fact that somebody actually has a number, which is a chronological age. I'm 50, I'm 42, I'm 45, I'm 30. And on the other hand, you have the biological changes that they came to your body through this time. And this is a biological age. And you're going to see people on their 30s and they look 50. And you're going to see people on their 50s and they look 30. So what it determines the biological age, skin-wise, and of course during the time that we evaluate the patient for a facelift, is if during the examination of this patient we have these changes that happen through the time that they can determine that this patient biologically is a good candidate for facelift. So if we have elastin loss, collagen loss, fat volume loss, and of course we have laxity of the skin loss and migration, descending of the skin, obliteration of the face, formation of jowling, turkey as we say here, obtuse submental chin-throat angle, lack of demarcation of the chin-throat line here, and of course deep labiomental folds. Of course, if you want to see that on a frontal view, as you see here, we have again on the frontal view here, we have this area here of the jowling. We have this area here of the turkey. And of course, we have all this lack of demarcation. In addition to that, we have some droopy eyebrows. We have some darkening and hollowing of the infraorbital region on the area of the eyelid, and of course some droopiness of the upper eyelid, that there is an obliteration of the upper eyelid. All this together, along with the texture of the skin, the lack of elasticity, they compose a facelift patient. This patient, of course, it cannot be treated with a single approach like Botox or fillers or something like this, because on top of the formation of wrinkles, we have this ptosis. So who is the patient who will be benefit from the treatment of facelift? Is a patient that is going to have ptosis. And ptosis is when these ligaments, as I explained you previously, and I'll show you one more again, on a lateral view, is when the zygomatic ligament, the mandibular ligament, the McGregory ligament, the frontal ligament, and the temporal ligament, they get loose due to gravity and of course some other reasons, environmental reasons, weight gain and loss. This difference in weight makes it even worse. Some environmental factors like smoking. Smoking is a horrible habit. It's a horrible habit for your general health, but it's a horrible habit for your skin as well. It makes the skin look yellowish, as you can see here. It accelerates significantly the destruction of collagen. More than that, it destroys the small vessels into your skin, the subdermal plexus as we name it, which make the skin very, very prone to many problems, even during surgery, but even during aging. And of course, because of the lack of oxygenation of this COPD patient, the oxygen tension is very low, so the metabolic activity of the collagen and the fibroblasts that produce collagen is very low, is lower, so the regenerative process of the skin is lower, and the aging, as we know, it's a non-reversible lack of regeneration and destruction of the skin. So on top of that, we have the loosening of these ligaments, and then is when we get into the problems to see that these patients, they have this droopy face. They develop, as you can see here again, the jowling, the chin-throat obliteration. Chin-throat angle is very obtuse, deep nasolabial fold, droopy eyebrows, lack of demarcation between the neck and the face. We cannot see the jawline, this very well-defined jawline, fullness on the mid-face, and emptiness here on the zygoma. So all this together, they compose a Glogau classification of 3, along with some actinic keratitis, actinic actually damages from the sun exposure, with another bad habit to do, of course. And as in my opinion, this patient will mostly benefit from a facial procedure which will actually elevate the face, and of course some additional procedures to treat the dermatochalasis and of course the sun damages. So for you to understand, the facelift procedure is just a procedure to elevate the face that it came down due to gravity. It's not going to correct the texture of the skin, is not going to correct the volume of the face. Sometimes by moving tissue up to the mid-face with a mid-face lift, we can correct and the volume of the face. Now, many things have been said in regards to different type of facelift. Nowadays, the facelift, we actually separate them in 2 categories. We separate them to the mid-face lifts, which is about this area here of the mouth and above. That's a mid-face. Lower face, which is this area here. And of course, the neck lifts. So a full facelift includes mid-face, lower face, and neck. Now, if you want to add more procedures to correct more ptotic areas, then you can add a brow lift, which is going to lift up the area of the brow, and a blepharoplasty, which is going to correct the upper and lower eyelids. So a combination altogether is a full face treatment, not a full face lift, because here we're talking about the brow lift, blepharoplasty, mid-face, lower face, and neck lift. So mid-face, lower face, and neck lift completes a full facelift. And of course, when we do actually brow and eyelids, we can add to the results that you're going to see later on. Okay, all these procedures can be done all together or differently. It doesn't mean that we have to do them all together. Sometimes we choose, due to the medical history of the patient or to the short recovery time the patient gives us, to do separately the eyes, separately the brow, and of course separate the face and the neck. So we can separate them, we can split them, or we can do them all at once. That's a very actually good way to understand what you need to do. In addition to this, if you really want to correct this skin color and this skin type, you have to add to these procedures some other procedures like laser resurfacing with CO2 laser, something we do very quite often. This procedure, the resurfacing, it will take out the dead cells from your skin, it will peel off your skin and let a new collagen form into the skin, a new epidermis to form and change the texture of the skin and smooth up the type of the skin. In addition, sometimes, most of these patients, they will have some volume loss because of the aging. The mid-face will be emptier. The under the eye area will be hollow and need some volumization, as of this patient you can see here. Look at this area, it's very hollow. You don't need to take out fat there, but you need to add fat in this patient. And of course, sometimes the eyebrow, it gets very, very empty and we need to fill it in with some volume. There is when that fat grafting technique comes, is my favorite one, and I'll give you another lecture and explain you, is when we go in and we put some fat into the area of the brow, to the area of the cheeks, here, to the area of the eyes, and we add volume to give more actually aesthetically pleasing faces. In addition, the most benefit of the fat grafting versus the other type of fillers is the fact that the fat is full of stem cells. And with the new technique we actually developed a couple of years ago, and we in our office we actually commonly apply the nano-fat grafting, where we take the fat and we process it to a nanomolecules, where we give it as an injection of mesotherapy. This fat is full of stem cells, and stem cells is type of cells. Now they do exist into your body. They change to specific cells, they differentiate to fibroblast, and they start producing collagen. So the difference between a dead filler, as I named them, which is hyaluronic acid or radius or whatever we use, and the fat is a live filler. It moves stem cells with it, so it will give, additional to the volumization of the face, some texture actually correction due to the differentiation of the stem cells to the fibroblast and start production of collagen. And all the recent studies of skin rejuvenation, they actually target these stem cells. And of course, in our practice, we add even more the PRP, the platelet-rich plasma. This PRP is an old actually technique thing. We take the growth factors from the blood and we inject it back to the face. Now, you have to understand that the PRP alone, these growth factors, without stem cells, is useless. It's not going to work. So we can use the PRP as mesotherapy. Mesotherapy is different. It's hyaluronic acid that collects actually molecules of water and hydrate the skin. The PRP is a growth factors concentration blood that needs to find the target cells, the stem cells, to activate them to produce collagen. So most of the time, we combine the PRP either with the microneedling or laser resurfacing to add some traumatic injury, so to expose the stem cells. Let's put it like this simply. Or if we need more and advanced actually results, we're going to add this PRP to an existing stem cell, which is a fat cell. So we're doing an nanografting fat cells, we put them together, we inject them to the face. So I hope that I give you some answers to all these questions, because you go all over the places and people, they start actually streaming you with many informations that most of them, they are not very clear to you. So you're going to get a PRP or a mesotherapy. You're going to get a fat grafting or a filler. You have to understand that everyone has a different result and different target of treatment. Yes, we can get all of them at once, or we can get some of them at once. It depends what is your problem and what is your primer, or what is your actually cosmetic surgeon is proposing. So for example, when this patient comes to my office, immediately when I see the patient, I evaluate three things. Number one, skin. I can see here that the skin needs some treatment, and here I'm going to start with laser. Second, I see volume. So we have some volume loss. And what I'm going to do, I'm going to treat this area here, and this area here with some volume replenishment. And of course, I'm going to add some volume to the nasolabial folds. Number three is ptosis. And what I'm going to do for that, I'm going to lift these areas. And where is the lifting? I can lift the mid-face, sorry, the lower face, because of the jowling. I'm going to lift the area of the cheeks. And I want to lift the area of the neck to create the appropriate and more aesthetically pleasing results of the correction and definition of the chin-throat angle and the jawline. And the third thing I would like to do is to give some treatment with stem cells, which is a nanofat, to protect and treat this color skin texture and give the tone to the skin that an aesthetically pleasing face has. You can see a simple evaluation of this face can immediately drive us to understand how many procedures we need to do in this face in order to get the optimal results. Of course, you have to understand that some of you come to my office or you get all over and say, oh, I'm going to do this without surgery. I'm going to be honest with you. When you have ptosis, there's nothing to replace surgery. Now, we can compromise the surgical outcome by giving an effect of improvement with different approach, but definitely we're never going to get to the same stage of result without surgical actually correction. Now, if a patient, of course, on the other hand, has no any ptosis, then you don't need to lift the face. Maybe this patient has a volume depletion and you need to volumize the face. So that's where the doctor has to come and step in and tell you that this is what you need, and you have to decide, because the cosmetic surgery is a clear agreement and understanding of outcome between a patient and a surgeon. So here is where it comes the communication, and what I do with my patients, I actually spend a lot of time to explain them. If I don't do this, if I do the lift, for example, and I don't do the laser, I don't do the nanofat grafting, I don't do the eyes and the brow, you're going to have a good effect on the lower face. You're going to have a lifted effect, but your skin texture is not going to change. The skin tone is not going to change. And of course, the eyes will remain there as it is. So whatever you take out, it will stay there, and we need treatment later on. Again, if you don't want to get the lift and you want me to fill in the volume depletion, I will improve the area of the eyes, I will improve the area of the cheeks, but of course the jowls will remain here, the chin-throat angle will remain there, and of course the lack of demarcation of the jawline will keep staying there. So that's how you do a consultation. You have to spend time with the patient and explain to the patient what should be done. And again, on the side view, you can see again, here we have this lack of volume through the eyelid, deep nasolabial fold, jowling, and chin-throat angle. And of course, again, I can say here, one, I need to correct the ptosis, lift. I need to correct the skin type, laser. And mainly we use a laser CO2 resurface combination. 3. I need to volumize the face around the areas of lack of volume, fat graft. And 4, I need to actually increase the anti-aging process and give some more texture to the face with the stem cells, nanofat, plus PRP. So 1, 2, 3, 4, 5 procedures will be added to this patient treatment in order to get the optimal results. Some of them during the process, the patient, they say, no, I don't want to get this. I just want to just fill up my cheeks to give some more elevation and contouring of the face, which is fine. Or I may need to do something different without getting the optimal results. You have to listen to the patient, you have to respect the patient, but at the same time, you have to be clear to the patient that what you get is what you ask for, and don't expect me to be the guy with a magician with the magic actually touch, that I will touch something with a little bit of fillers and everything will get away. And I'm going to come back here and I'm going to show you and explain you what we've done to these patients, and you will tell me what you see. And here is this patient before and after. Sorry for this, trying to download. It's better on my iPad, as you can see here. All right, you can see here. So in this patient, we added 3 procedures. Number 1, we did a lift, and you can see on the left here, this is actually before. Sorry, this is the after. And this is a before. And what we can see, what we've done in this patient, we fill in this area with fat, as you can see here. Very nice obliteration and scaling of the area of the under the eyes circles. We proceed with a facelift and a mid facelift. And you can see obliteration of the chin, of the labiomental folds, correction of the jowling, definition of the submental area, and of course mid-face elevation. And we didn't proceed with any brow lift or any blepharoplasty because this patient didn't want to have this. And you can see that still we have some brow ptosis that we may address later on. But on the mid-face here, we added some volume to change the picture of this patient. And I'm going to put this on the side, and you can see the definition that we achieve on the chin-throat angle. Look at here, this chin-throat angle and this chin-throat angle. All right? Definition of the jawline. Look at, there is no jawline here. Look at the very nice definition and demarcation of the jawline here. Labiomental folds, and of course, what we done, we took away all the area of the jowling here. All this jowl is being disappeared. So, and of course, look at the texture of the skin. After we apply a CO2 laser resurfacing with a little bit of PRP, we change significantly on this discoloration, the texture of the skin, and of course, we had some Botox on the forehead and some fat grafting on the area of the eye. You can see a huge and significant change of the eye along with the mid-face and the application of the fat. So, again, a facelift procedure is a very nice procedure. It's a procedure that we do quite often. And of course, most of our patients are very, very happy. What I'm going to go through now, I'm going to go and show you a couple of my patients and what we've done to them just for you to understand and come back and discuss. So that's a younger patient, according to your question, that's a patient of the age of 42 who has a little bit of like dermatochalasis, and you can see some ptosis here. As you can see here, we have some ptosis. We have some lack of demarcation and some fullness. What we've done to this patient, on the other hand, we went in, we fill in this area here. We fill this area in. You can see the very nice delineation of the jawline. You can see the obliteration of the labiomental fold, and of course all this jowling is being removed. That's a patient, again, that we perform fat grafting and lower facelift before and after. Another patient here. This patient, on the other hand, is a younger patient that has no any ptosis, has no any jowling. He has a little bit of a protruded chin, as you can see here. We decided to proceed just with liposuction, just with the neck liposuction. We've done nothing more than just neck liposuction, and you can see the very nice demarcation of the jawline versus before. You can see nothing. All right, again, you have to evaluate the patient and offer them the optimal treatment. As you can see here, in this patient, we've done nothing more than correcting the neck with just application of a smart lipo. Excuse me for that's an older patient who had a facelift before. You can see this wrinkling and this sun damage all over the place. So in this, some loosening of the platysma in the neck here. Of course, and the lack of demarcation and all this hyper-inflammatory reaction of the retinas and the varicose veins that we get there. So what we've done the following now. We actually lift up this patient. We put a nano-fat grafting and fat grafting on this patient, and we aggressively laser resurface the skin, the chalasis that we had, in order to clean up the area of the very fine lines. Another patient, a 65-year-old patient, as you can see here, we have significant dermatochalasis of the neck, significant obliteration of the area, but in this patient, as you can see, we have a lot of volume loss, significant volume loss from the mid-face, from the area of the cheeks. Of course, all this volume make this face look skinny and ill. So what we've done in this patient, we performed with a lifting to remove the excess skin, and of course, we went back and we grafted this area with a nano and fat grafting and a laser resurfacing. And you can see the results before and after. What I would like to make clear to you is many of our patients, we can do a procedure and we keep following our patients. They come back all the time for more actually results. Another patient, again, here you can see very clearly the fat that we added to the facelift, of course, the resurfacing for the skin texture, and of course the nano-fat grafting for the stem cells rejuvenation. And again, we have patients from all over the ages, from age 40 to age 60 or 80. I did a facelift on a patient, I'll show you, about 80 years of age, which was very, very successful because mentally we do this procedure for us. It's just for you to feel okay with your mirror, to give confidence, to be happy, to can go back to your work and feel that you are productive. Number age, chronological age, has nothing to do with it. And here's my friend Alida that we've done a facelift on her, and you can see before and after the pictures. We did a lift and a volumization. Younger patients that we corrected with different, and older patients, as you can see here, the difference in the area of the neck here, which is very important for you to understand what we've done, and of course the chin throat angle that is being very nicely set here, that it wasn't there before, as you can see. The other thing I would like to tell you is, and I'm going to show you now a couple of videos, is what type of facelift we do. There is different type of facelift access-wise. We have a smash lift, deep plane lifts, skin lifts. I really don't do any skin lifts. I don't believe on them. I think it's a big mistake just to lift up the skin, put tension on the skin and pull it back. That will actually come back to where I used to be before in about 6 to 10 months. Even on a younger patient, this doesn't going to work because the retention ligaments, these ties that I told you previously, if you don't release them, they're not going to let you have the skin where you put it. It will look okay for a couple of months because of the swelling and the tension. The other big thing you're going to get significant actually scars around the area of your incision, and I'll show the areas of incision in a minute because these scars it will create it through the tension you apply on the skin. What we normally do in our practice, we do deep plane lifts. So what we do, we elevate the whole fascia, the whole composite muscle and fascia, and we pull it back and we just let the skin to redrape. And I'm going to show you a couple of those patients. If you excuse me here for finding my photos. Here they are. And before I go even there, I'm going to show you this impressive video here I have from my patient that I've done the other day, who sent it to me, which is showing exactly, realistically, how it works. It takes some time to download it. Lovely. Hopefully it will work when it comes down. No? All right. Maybe this one works. And you can see that the patient live, before and after. You can see the before on this side and the after. As you can see here, big difference. And look at live. Now there's no pictures, there's no Photoshop, there's nothing. You can see the very nice delineation of this patient, how happy this patient is. Of course, what we've done, we lift up all this area, we corrected this chin throat angle, and of course, we give some more volume and texture to the face. That's a live video from the facial. This is the before on the left, here is the before, and that's the after on the other side. You can find more information, tons of videos live in our website. Of course, and Instagram and Facebook is the two tools that we use. You can go on our Instagram page, CyprusFacialSurgery in Instagram, or CyprusFacialSurgery in Facebook, or www.CyprusFacialSurgery.com. You find all the information you need and a lot of videos to prove what we do. Of course, since we are very, very actually unhappy when we don't do facelift because of this coronavirus. We sit in the office sad and we're waiting for patients, we're waiting for this procedure or this restriction to go away, but what can we do is very important to keep up and save our lives. We love doing facelift, we love your face more than you do, and that's why we're here and we give you all these explanations. I'm going to try now to see if I can find one of those procedures we do in order to explain you what is the difference between the different types of facelifts, deep plane facelift versus a skin lift. So going back, the other part is the lifts that we do is the lifts that is a smash lift. So what we do, we take a suture and we put back the smash. That's a different way of doing a facelift. It's a very potent way. It's good, it's better than doing a skin lifts. It lasts for 5-6 years. We just suture the smash, the tissue with the muscle and the fascia underneath the skin, and this actually retracts back the skin all the way. That's another way of doing this, and of course it has its own benefit. It's good. I do it for young people that they don't need a lot of lift. I do it for people that they actually don't request significant removal of skin. At the same time, I do it on heavy smokers, that these heavy smokers, they may not be a good candidate of a deep plane facelift. But what I'm going to show you here now, and hopefully this will work, when it comes. I'm going to show you just a small thing what we do in the operating room, and what a deep plane facelift. That's a gold standard, is a deep plane facelift. And what a deep plane facelift is, if I extenuate this, we go deep and we lift up this muscle here. We lift up the muscle, and by lifting up the muscle and pulling back the muscle, we manage to get, as you can see here, the best of it. That's the muscle lifted up, all right? So by lifting up the muscle, as you can see here, we get a permanent results. We get the results that they look more natural and they last forever. And of course, as you can see, our patients immediately after, they look a little bit swollen, but not bad. All right, that's immediately after. And in a week, these patients, they can return home. This procedure, a combination of a composite facelift, as you can see here, a composite facelift, we lift everything up and we pull it back. And when we pull it back, you can see on the front here, over here, all this jowling in the neck, they come forward and up. We correct through the muscle all these ptosis that it happens through the years. And by doing that, we're sure that we have a permanent result and a natural result. And I'm going to show how much skin we get when this comes back. When you finish with this, actually, you're going to see a lot of skin coming back. Hopefully we'll show here. I'm not sure where this video is, but it's not of a very big actually concern, because yes, when we do this, we combine this most of the times with a liposuction, and that's what we do. We take this cannula, and what we do, we take out all the fat from the neck, we defat the neck along, and the patient during this procedure, that's the amazing thing, as you can see here, is totally awake, totally awake. We don't put people to sleep for a facelift. We just give them some oxygen, some slight sedation, and we do this. And as you can see here, we just finish up with the liposuction. Just finish up with the liposuction, as you can see. And you can see with this small hole, the very nice delineation of the neck. And again, this is a procedure that is being done under local anesthesia. The patient is totally awake. There is no pain and a short recovery. It is a newstylelift procedure that we do nowadays. And of course, we combine it many times with brow lift and some other procedures if it's necessary. But again, you don't need to go to sleep for this procedure. Of course, we love your face more than you do. That's what we do in operating room daily. We treat this patient. Again, in our practice, we believe in a composite deep plane facelifts. We don't do skin lifts. We don't even do smash lifts. We do composite facelifts. These facelifts, they last longer. They have the most natural results because you really cut the muscle. The area of adhesion is bigger. So you pull back all these muscles along with the skin. You remove the excess skin, but at the same time, you correct the area of the ptosis. And by loosening and releasing these ligaments, these ties, you really give a good access and opportunity to the skin and the muscle to lift up, because you have no retention from the ligaments back. That's a big difference. That's a big difference. And even though it shows as a big surgery, really it's not. It's a small surgery, and the recovery time is very, very short. All right. And the last thing I'm going to do, I'm going to show you here where we place these incisions, because plenty of you ask me all the time, okay, where we place these incisions. And I'm going to go here on my facelifts, and I'm going to pull up the incision actually pictures so you can see. Now, that's the incision of a full facelift. What we do, we just make a cut in the hair, into the ear so you don't see it, and behind the ear into the hair. From this incision that you can barely see as I show you in my videos, all right, you get the treatment. Now, if you don't want to do the neck and it's just a face, you don't need to extend behind the ear posteriorly into the hair. So you do this small S lift, this like an S, and with this S lift you can address this area here, but you cannot address the neck. So with the S lift you can address this area here, but you cannot address the neck. Versus the previous one, that with this incision we get access from here to the neck and to the face and to the mid-face. So you can see that with this incision we will address this area of the face quite often versus the other one that we just address the area in front of the ear only. Now, in our technique with the newstylelift, we change a couple of things. We do the same kind of incision, but we don't dissect the face all the way to the front. In the past, that was a very, very common thing to do, to dissect the face all the way like this. And with this big flap, you could actually elevate the skin. The problem with this big flap is the fact that now you have all the skin elevated and all the skin devascularized. So if you have a heavy smoker or a patient with significant illness, you can get significant problems with necrosis. Now what we do, we just open the skin up to here. Only this. And by taking the muscle, and we undermine the muscle up to here, so this area here will be elevated, but through under the muscle with a deep plane facelift, we can have a very nice, potent, and very, very effective facelift without significant risk of skin necrosis. All right? Of course, we do sometimes S-lifts in the younger patients that have a little bit of jowling here. And with this S-lift, I want to do this and just pull back a little bit this area of the jowl only and define the jawline. But I cannot treat the area of the neck. I cannot treat the area of the mid-face. I cannot treat the area of the posterior neck. And even sometimes we don't even want to go on the back. We can do just this area of the face with this L-shape actually flap that we advance. Sometimes we may need to add the brow on this area, or we're going to go and do it through small incisions here, or we just change our incision all the way here in order to approach the area of the brow and the mid-face. The problem with this sometimes, by lifting up significant tissue, what is going to happen here, it may move up the hair, and this hairline from here, the sideburn, we may move up there, and you're going to have a little bit of discrepancy that the patients, you as a patient, don't accept. And on the back, you can see a different type of trichophytic, or I don't really make any difference to any one of you. So mainly, the other thing we add sometimes is this temporal actual incision here. Instead of the one we put there, we just do the temporal one, and from this endoscopically, that's what I do quite normally today. With the use of endoscope, I just elevate the area of the mid-face here, of the orbicularis oculi muscle up, and the brow up, and I get this mid-face and brow elevation endoscopically through a temporal incision here. That's some add-ons that we do, and of course with subciliary incision, I take some skin out here. Most of my blepharoplasties, I do them in transconjunctiva from inside the eye. And the one incision I normally do is the incision under the chin, the submental incision to treat the neck. You need that to treat the neck. You need that to address the platysma. If you don't get that, most of the times the neck will not be treated and your chin-throat angle will not be corrected. I do it only on the patients that they have problem with the neck, but it's very important incision to do. So, that's what I had to say. That was actually a brief overview about facelifts. Who is a good candidate for a facelift? I told you. It's about age. Plenty of you're asking me what is the cost of this procedure. There is no any specific cost, right? It depends, as I show you, different type of facelift, different degree of treatment. So the procedures actually depends on how much of surgery you're going to have, how many hours you're going to be there, and what is actually needs to be happen. In range, approximately for 4,000 to 7,000, mostly this type of facelifts, just for you to have it out. And of course, What else I can advise you? Who is a good candidate? I said is a patient who has ptosis. It's not a chronological age, it's a biological age. Who is the best to proceed and do this procedure? Is whoever had actually good experience, does a lot of them, has a good training, is a good surgeon to trust. Thank you very much. Welcome to Cyprus Facial Surgery. Please keep following us on Facebook. Give us a like. Keep following us on Instagram. You're going to find a lot of information, a lot of updated procedures that we do nowadays on blepharoplasties. Please subscribe and follow us on our YouTube channel. That's a new YouTube channel that we have. Is more extended videos. For anybody of you that wants to go in details, the YouTube is better to follow. All of them, they have the name Cyprus Facial Surgery. And of course, call us in our office phones, 2247-6636. We're there. We're going to be there during the coronavirus, just mainly to serve emergencies and help all of our patients with any needs they have. But we're there. Keep calling us. We're more than happy to serve you, to answer your questions, even see you if you need us. I'll give you updates and information about even the coronavirus. Thank you very much. Welcome to Cyprus Facial Surgery. This is Dr. Nia today. Hopefully you had a good information about, facelift in Cyprus Facial Surgery. Thank you very much. Have a good night and be careful and save yourselves. Thanks everybody for watching. Much appreciated. If you like this video, click the thumbs up button. For more information, check out these links. And if you're new to our channel, please do not forget to subscribe and to turn on your notification with the bell icon down below to get all of our new updates in your feed.